Learning Plan 2, IV push medications, nursing advanced skills. So what's the difference between IV piggyback and IV push? So IV push is a rapid injection where IV piggyback has a longer infusion time. IV push has small volumes that we give, and IV piggybacks are usually larger volumes. IV push is administered using prepackaged syringes or drawn up manually from a vial by the nurse or pharmacist into an actual syringe. And IV piggyback can be pre-mixed as well into a bag of fluid, or we can mix it manually, or the pharmacist can mix it manually. IV push is typically given through a syringe. IV piggyback requires an IV pump or an IV drip for management and requires the primary IV tubing and then the secondary line tubing for the piggyback. IV push can be given through just a J loop with no IV fluid running, or it can be given with IV fluids running. But IV piggyback, usually most, require a primary line, not all, but in generality, it's usually needs a primary line. All right, let's talk about the difference between looking up oral medications and IV push medications. You guys already learned for IV piggyback what should be looked up, so this should be somewhat of a review, but yet there are some things that really kind of stand out for IV push. So we always want to know the class of the medication, how to give the IV medication, the dilution, the amount to be given, compatibilities of what's hanging, side effects, nursing implications, any lab work that's pertinent that we should be checking before giving it, the antidote or antidotes if there's more than one, why the medication's going to be given, and how fast we must actually administer it. So a lot of those are the same as our IV piggybacks, but the biggest additions or things to remember in comparison to oral medication administration are the dilution, the compatibility. So we're always looking up and comparing what's already hanging to what we're going to be giving, or if we're going to be giving back-to-back medications, is it compatible? Because we don't want any reactions or crystallizations in the IV tubing. We always want to know the rate of infusion. So usually for IV push, this is usually minutes. Typically 1 to 2 minutes is the average for IV push medications. And then we want to know the antidote because we're giving IV medication. It works so rapidly. We definitely need to know what's the antidote and be prepared if we need to be doing something about it. So on your slide, you'll see that those 4 main ones are starred for you. So that way you definitely do not forget those. Now, we have the 3 little pigs or syringes, however you want to think of it as. I did the 3 little pigs to help you memorize things. Our first pig with the pink bow is Sally, and then we have Megan and Sadie. So it's SMS. So this is in regards to giving IV push medications through a saline lock, or sometimes also referred to as HEP lock. So that's without a primary line running. We use 3 syringes, so just that J loop. So we start with saline after we clean the ports, obviously. We start with saline to flush the J loop and to make sure that the line is patent and clear from any other potential medications that could still be in the line. And then it can be given at any rate. Just make sure to check for a blood return and use the push pause method for clearing the line. Now, just because you get a blood return, well, getting a blood return means that it's in the line, but sometimes you don't get a blood return, and that's okay too. It doesn't mean that the line's not working. It may just be that the vein's so small that it's collapsing when you're pulling on the syringe, or that it's up against the valve. So you would definitely push a little bit of fluid in and check the site and ask if there's any discomfort to the patient. But blood return is usually always a good sign. Then we go ahead and give the medication. So we clean the port again, and then we hook up the syringe with the medication. And it's given at the appropriate rate. Like I said, most common rate is 1 to 2 minutes. And then we go ahead and take the syringe off, clean the port again, and we hook up a second saline. So we follow with saline at the same rate the medication was given, because there's still medication in that J loop. And if we just push that second saline into the line without doing it at the same rate as the medication, we'll be giving the rest of that medication faster than the recommendation. So this could actually end up in reactions or side effects causing harm to our patient. And we don't want any harm to the surrounding tissue or to the patient in any form. Intermittent and continuous infusion set. So here, this is what we need to do when we're going to be giving an IV push with an IV line that's already running. So we need to first choose the port site closest to the patient to minimize the distance the medication actually has to travel down the line to get to the patient faster. So in your picture, you will actually see that the port that's closest to the patient is right, if I can get my pointer here, right here, and that's where the syringe is hooked up. So J loop and then the primary lines here, and that's the port closest to the patient. And then we will obviously clean the site and attach the medication syringe. And when doing that, before we start pushing anything, we're going to pinch or clamp the IV tubing between the IV bag and the port. So usually it's just above where this port is. So you can actually pinch it right next to it. So you don't want it below it, you want it above it. And what that does is it prevents the medication from being injected back towards the IV bag because we don't want the medication going that way. We want it going towards the patient. Then we go ahead and aspirate and check for patency because we don't want any medication pushed into the local tissue causing irritation or even necrosis. Then we go ahead and administer that medication in small increments uh, over the time that it should be given while observing for any reactions. And giving it during those small increments allows us to actually catch any reactions before the whole medication has been injected as well. So again, that's doing it over the 1 to 2 minutes, or maybe it's 5 minutes. And then you can choose to pinch or clamp intermittently while you're pushing that medication into the line, or you can just leave it pinched the whole time. So that's entirely up to you. Neither of them are wrong. You will also see that sometimes if you're unsure of if there's compatibility or anything, that people may use the SMS, the saline medication saline, even with a running line. That's not necessarily wrong. It just is extra precautious. So you would have a running line, you'd flush it with saline, and then you would give the medication and then flush the line behind it. So that's not wrong either. So that's all that we have for this PowerPoint slide.